COVID vaccine boosters and severe side effects, warns CDC official. Pfizer wants to roll out vaccine booster shots to better fight COVID-19 variants. That came after data from Israel showed waning protection against the disease, more specifically the Delta variant. But a U.S. health official doesn't agree with booster shots for the general population at this time. Without sufficient information, experts cannot easily recommend boosters because of one thing: side effects. Medicines come in different forms and doses. Your prescription should note the doses you need for every intake. This is because dose information may indicate the chances of side effects. The higher the dose, the higher risk of side effects in most cases. So, doctors sometimes lower the dose, if possible, to alleviate the discomfort of patients. The same principle may be applied to vaccines. According to Jay Butler, Deputy Director at the US CDC, they are more interested in whether the third dose may be connected to a higher risk of adverse reactions. If so, they want to know the level of risk, especially in reactions deemed severe. For those who haven't heard, the two-dose regimen of COVID vaccines is associated with higher rates of side effects, but in exchange for higher protection rates, compared to just one dose. What the issue with boosters is no one fully knows how they can modify the safety profile. Will the higher risk be worth the added protection? Will the protection level further increase? Can the human body still handle such risk? These are some questions science needs to answer first before deploying the third dose to the general public. What about those with pre-existing health conditions? Right now, Butler sees the potential of boosters in those at risk of severe COVID-19. The elderly, immunocompromised, and other groups with greater risk may actually get more benefits. Though the US government hasn't recommended a third dose at this time. In Israel, however, the situation is concerning and the government wants to control it before it gets out of hand. Thus, Israel started giving booster shots of the Pfizer vaccine to people with weaker immune systems, reported the Wall Street Journal. It is believed that the third dose may increase antibody count. The country's health ministry recommended a gap of 8 weeks between the second and third dose. But if someone needs it soon, the minimum gap is 4 weeks. With the rolling out of boosters in Israel, the government is now evaluating if the campaign may include more people.